From performing tummy tucks and breast augmentations to meeting with past and future clients, this Surgeon's Day could be too much to handle. Plastic surgeon Sanjeev Kala on this episode of TV Cogeco's In Their Shoes. Who hasn't wondered what it would be like to be someone else? To live a different lifestyle? To have a different profession? This is TV Cogeco's In Their Shoes. Located on the St. Clair River and home to more than 70,000 people is the city of Sarnia. The city's natural harbour was the main attraction for French explorer La Salle and settlers in the early 19th century. Today, Sarnia is a centre for freighters carrying grain and petroleum. The city's port and nearby oil springs birthed a large petroleum industry in the area and now accounts for over 40% of Canada's chemical production. The city's Blue Water Bridge, providing a link to Michigan, is one of Ontario's busiest US to Canada border crossings. One beautiful Sarnia morning, plastic surgeon Sanjeev Kala readies himself for a most typical day.
My breakfast, typically, I try to stay really healthy. Only in what I eat, I try to be cautious in what I eat nowadays. Just because I think as you get older with cholesterol and diabetes risk and all these things, you got to these days. So, you know, I a lot of grains and healthy cereals and my papaya and stuff that I have in the morning. And then I usually sit out on the screened-in porch and just watch the water. It gives a little calmness to yourself and puts you in perspective. Because the day's very busy, so it's nice to have that calm, quiet start and looking at the water. There's always something different every morning to look at. I mean, things happen on the water. I mean, large ships go by, and you know, there's actually deer sometimes that have actually swum to the island and back, and so lots of interesting things to see. So it's good to take a morning stroll, and then you know, not shortly after, get in the car and off to work. A Shelby Cobra, kind of historic car in its own, has its own story and history behind it. It's a 500 horsepower monster, so to speak, from the 60s. It's fun to drive, just because of the different feeling it has and the aura it has about it. It has a different kind of life to it than some of the newer vehicles that they have. When you spend a lot of your time making people younger and newer, it's kind of nice to sometimes enjoy the older things. Blue Water is primarily a cosmetic surgical center, so mainly we do what will be classified as cosmetic plastic surgery. So facelifts, nose jobs, you know, ear, pinning, breast augmentations, breast lifts, tummy tucks, liposuction, that kind of thing, to make people kind of change their appearance, so to speak, and more than their appearance, really change how they look at themselves. Hey, Carol, how are you?
Yeah, hi.
All ready to go?
Yep.
Okay. So what I'm going to do is I'm going to hit you stand up here.
Okay.
Okay. So, you a little nervous?
A little bit. I must be. My blood pressure's high.
Well, that's normal. If you weren't nervous, I'd be nervous.
Okay.
So I'm going to do a bit of scribbling on you here, okay? So.
I had a abdominoplasty, which is the fancy name for a tummy tuck. And I'm a little overweight now, but even when I was thin, I had a bulging abdomen, so I said I deserved the surgery. My main apprehension was just the care that I would get, both in the surgery. I wanted good surgical results, but being a nurse, I know that there's more to surgery than that, and I wanted to make sure that I had nurses that were watching over me closely. I wanted to make sure the anesthesiologist was well qualified.
The girls took the photos of you already?
Yes.
Okay.
I kept joking with people before the surgery, saying, just make sure I keep breathing. Those were my... main concerns is just quality of care and breathing, of course.
Have a seat for 1 second. I'll get Sheila to come get you, and we'll get you in the OR. Okay, guys, ready to go? Ready to go. Okay, let's do it. You know, an understanding of abdominoplasty, first you have to understand the motivations of why to do abdominoplasties. And there's really two groups of people that do them most of the time. One is women who've had children and have stretched their abdominal skin and got stretch marks, C-section scars, loose skin, kind of a bulge in their tummy they can't get rid of. And that's one major group that does this kind of surgery, and quite rightfully so. They don't look the same anymore, and they want to look the same. The second group that would do the surgery would usually be people who lost weight. And if you've lost an extensive amount of weight, your abdominal skin usually gets fairly loose. And again, usually these people feel very happy and motivated by the fact they've lost their weight, but then they're somewhat disappointed by the fact that they look kind of like a loose bag of skin, especially in the tummy. If you know that, then you'll kind of understand more about what we do and why we do it.
While Dr. Kaler scrubs up and prepares himself for the first surgery of the day, his team prepares his patient. It is vital that the surgical staff and instruments are in place and sterile, and that the patient is well cared for.
You gotta keep those hands really clean when you operate on people. You really gotta scrub every little finger. Now we're gonna hop into the operating room, and our patient should be prepped and draped and ready to go. All right. So, there we go. So we make an incision usually in the underwear line, just above the pubic hair, and then we take the skin and fat and we lift it right up, all the way up to the top of the rib cage, so we can see the abdominal muscles. The cautery, and that's used to actually cut tissue at the same time. It actually burns the blood vessels and seals them, so you don't bleed as much, which I'd say is a very useful tool in surgery. It's been around for a long time, but prior to this, it would have doubled or tripled the operating room time, because you have to tie off every single blood vessel. Now with a cautery, it saves you a lot of time with that. And most of the instruments that I use for my cutting and handling are all titanium. They're light surgeries. I find if the less you do is more. You know, if you can get a surgery done with less cutting, less bleeding, less sort of anesthetic time or downtime, the faster that patient will heal and the better they're going to heal. And originally you'd think, oh well, I can spend 6 hours and do tons of intricate little work and so on. Sometimes that's actually worse for the patient than spending a little less time and just focusing on the few little things that will make the change and let the body do the rest. And that's something I've learned over time with experience doing surgeries. So the muscles are split apart. That's from having kids. It makes it kind of bulgy and weak. It makes your back pain not. You should have more back pain too, actually, usually. And so these muscle problems all happen usually after kids. And it's really a good part of the tummy tuck is to correct all this. And the majority of these people will have some laxity or looseness of their abdominal muscles. So we actually tighten those and put them right together, which sucks their tummy right in. Okay, and makes the core muscles actually stronger too, because they're oriented in the right direction now. Whereas when they're stretched out, they kind of don't have the same angle in which to pull. Every motion of your hands counts. So you want to minimize the motions and be perfect in every motion that you do. And it's kind of something to strive for, I think, in surgery, and do a perfect move with every move. It's, again, something that's not easily achieved, and every once in a while you don't get absolute perfection, but the patient wakes up and there's less bleeding and less bruising, and they're very quickly back to their normal life. Things like that. Then, once we do that, we basically take that skin and fat that we lifted up and we pull it down.
They're under the big umbrellas, and my daughter comes.
We then redo their belly button and because we obviously cover their belly button over, and we pull that skin down so to put it back through. I usually give them a nicer belly button. And get it really tight and we just cut off the extra. And most of the extra usually is everything from the belly button down to the pubic area. And that goes away. And for most people, that's where their stretch marks will be if they have them. So their C-section scars or hysterectomy scars if they have them. A lot of loose skin in that area. And that sort of just tightens everything up. And then we sew it back up. And the incision is in a place where it's very easy to hide because of the underwear line. And that's basically the gist of the operation. It tightens the muscle, gets rid of fat, and tightens skin, gets rid of scars, and gets rid of stretch marks. It basically rejuvenates the abdominal area completely. And so for a lot of people, they get quite a nice tight abdomen with defined muscle lines and so on and so forth. And it changes the way they perceive themselves, and that's right in the middle of their entire body. So there's an example of what we do with the tummy tuck and kind of how it affects someone's thinking and their mind. I mean, there's art in so many things, right? And then there's art in the way you do anything. And I mean, you can find art in the way you breathe. You just pick any little object and kind of decide to perfect it, you can. And surgery is the same. And the beauty of plastics is so vast. We have so many different operations we can do that you can spend your life perfecting that art.
When the last stitches are in place, the team reassembles to clean, wrap and transport the patient. Meanwhile, Sanjeev completes his paperwork and hurries off for the first checkup of the day.
There's no end to the amount of work involved in dealing with the patients and getting all this surgery organized and scheduled and booked, and it's quite an arduous task. So these guys are out here and they're basically a huge part of the team. You really want a nice person there at the beginning and the end of the story, so to speak. And it's kind of like a story, the entire surgery for everyone.
I never, at the end of the day, go, God, it was kind of a boring day. You just, the whole day, nonstop, right through, and you feel like you accomplished something at the end of the day. When you get your list done and all your phone calls returned, it's just a sense of accomplishment you feel.
And what I like about working here is it's kind of exciting. There's always something different going on because we have our own private clinic here. If they want to get it done in a timely manner, they can. They're not waiting for hospital OR time. So that's a definite advantage. And the care here is a lot more personalized and private.
We have patients that are very, very big on confidentiality, which is understandable. So some patients we try to put in the private rooms right from the beginning. So that way, maybe even people in the waiting room are, noticing them, stuff like that. Sometimes it's just about the surgery. During the surgery day, they don't want people seeing them. Other patients are really excited. They want to tell everybody in the waiting room what they've had. They're like, look at these, and they'll pull out. They're like, this is what I've had done. So it really can range from one extreme to the next extreme. The schedule's really hard to do sometimes because he is really busy. Fridays are like the hardest because sometimes he's at the hospital, sometimes he's here. OR days are pretty straightforward. I think what we just try to do is to keep him as organized as possible.
Well, those follow-up meetings are one, to make sure that there's really nothing wrong that's going on and that things are progressing in the normal course, in the normal manner you would expect after surgery, and make sure they're medically fine, there's no infections or problems or scarring or healing. And so that's primarily one of the main goals. The second thing is to kind of support them as they go through this, because when you do surgery, for definitely an initial time, there is some downtime, both physically and emotionally.
We'll get you all wrapped up here. So any more questions? Any other questions at all?
No.
Okay, go for it now. So 2 months.
A short time, they're going to start thinking in their mind, wow, what did I do? Because they felt normal, although they didn't probably look like the way they wanted to. And now they feel sore and hurts. And now, especially in the short term, if they're bruised and swollen, they may think they look worse than they did. So there's that time where they need to be reassured, and they need someone who's actually seen thousands of these things happen to say, yeah, okay, that's normal, and don't worry, in a few weeks or in a few days, things will change a little bit more. And so it's good to kind of follow them along and see how they're progressing, and make sure if there is any problems you can intervene, and if not, you just kind of support them as they get better. And most of them you'll find that sort of after a few weeks the tides turn, so to speak, and the pain is gone, and the swelling's gone down, the bruising's gone away, and they really start to see the results, and they start to get